Hey guys, this is Dr. Mahajan from Mahajan Medical Center. I'm very excited. We got a great program lined up for you. It's a two-part series for dementia or memory loss. It's going to be a great program. We're going to have one of the caregiver join us who is dealing with memory loss and dementia with his wife, and he's going to share his insight in his journey. His name is David. Very cool guy and very knowledgeable guy, so you'll enjoy his presence on our second part of this webcast. This is again Dr. Mahajan. I'm a board certified internist. I'm in Largo, Florida, and we have a primary care practice, and we still accepting new patients. So do refer your friends and family to us. As a small practice, it's very important to get the new referrals. And do like us and love us. And we get a lot of enthusiastic response since we've been doing this podcast for almost 4 months now. And every place I see or go, they say, "Hey, Dr. Mahajan, we enjoy your webcast," but I don't see any comments from them. So we're going to have a special raffle starting to see who is watching us. So we're going to do a raffle on every webcast now for anyone putting comments or questions regarding the topic or breathing or any other suggestions they have. And then we're going to put all of them in the raffle and then we're going to announce the raffle winner in our next webcast on next Thursday at 4:30, as we do all our webcasts on 4:30 on Thursday. So if you are watching us, do say hello, Dr. Mahajan, or if you have a question regarding memory loss, dementia, or you like my previous webcast or something, just do put in a comment section that give me encouragement that you guys are not silently watching, you're actively participating. And then all of you will be in our raffle draw today, whosoever put comments today. And it may not be live if you check my webcast later as you come back from work, and a lot of you folks do that. I was talking to Kristen. I'll give a shout out to her. She was saying, please give me a shout out. She's a PA at Modern Plant Emergency Department, does a fantastic job with working up patients as frontline worker. And she was saying, "Oh, I watch your webcast." And I said, "I don't see any comments from you." So then that's when this idea came to me that I need to get all those invisible admirers out for Mahajan Medical Center webcasts. And that'll be great. We can announce the winner, and then, we can, if you put a comment, and kind enough to do that. So without further ado, let's get started with our webcast today. Is going to be very useful because dementia or memory loss is a very big epidemic. 5 million people every year is getting diagnosed with Alzheimer's. And, if you look at the new data from Alzheimer's Association, if you're age above 75, your risk of getting Alzheimer's is tremendous. So let's just put a disclaimer here. Let me do that. This disclaimer is saying basically that whatever we are saying is for education purpose. It should not replace your professional relationship if you're my patient with me, or with your other physicians. This is what I do on the webcast is primarily to, give the community food for thought, maybe help them sort things out, but it should not replace doctor-patient relationship. So since we got the housekeeping item out of the way, let's get that out. And let's start with, let me share the screen with you. Here we go. So if you look at, let me get this share and like and love. Hopefully you've done that. And then you don't need that screen anymore. All right, so dementia is a lot of time a umbrella word. What I mean by that is, if you look at this umbrella, which is on the screen, it is like heart disease. So heart disease, for example, includes heart failure, includes coronary artery disease, includes cardiomyopathy, includes a lot of other hosts of heart conditions. Same thing with dementia. Dementia is a umbrella term for memory loss. The most common, about 50 to 60% of that diagnosis is Alzheimer's disease. The rest, as you can see in this slide, and I'll go over one at a time, the other common is vascular dementia, if you had strokes or your loved one had strokes. All right, we got 2 comments up there. We'll come back to them in a minute. Let me finish on the definition of dementia. And you guys keep writing the comments if you want to participate in the raffle for $25 gift card. We'll do that with anyone who puts a comment. Everyone will be included. And, that just tells me and gives me encouragement that you guys are watching. All right, so let's keep moving along. So frontotemporal dementia, mostly we see in people in middle ages, in their 50s and 60s. Dementia with Lewy body, that people have more visual hallucinations, other kinds of, psychiatric disorders. Sometimes they get mislabeled into psychiatric conditions, and they have Lewy body dementia. And then people with Parkinson's disease or Huntington disease, they can also get memory loss or dementia. And there's corticobasal degeneration, and there's progressive supranuclear palsy. So these are, the common terms for what we use for dementia, which get included in that diagnosis. Let's get out of the screen, and we'll come back to this video later. All right. So, as you can see, dementia could be a lot of different things, but it's not senility. A lot of folks confuse saying, hey, memory loss is part of the aging, and it's not. Memory loss is not standard as you get older. Yes, it happens more in older folks, but not everyone who is in their 70s and 80s and 90s have memory loss, which is affecting their quality of life. Yes, you get some memory loss where you lost your keys, but you remember it later. People with dementia won't remember where they put their keys. So then that leads to the next question: what are the early signs and symptoms, or 10 signs and symptoms of dementia you should watch out for? The first one we just talked about earlier, the memory loss which disrupt daily life. That's what the loved ones notice, and the patient may resist it, and that's very common. I see in my practice, in geriatric practice, that the patient will not accept that they're having it, and their daughters are the most common one, which bring their moms with them, or the husbands or the wives. They notice that first, and it's very difficult for anyone to accept that, which is understandable. No one wants to get stigmatized with dementia or Alzheimer's. So what are the other symptoms you should be looking out for? The challenges in planning or solving problem. Different parts of the brain is responsible for different functioning. So it is different neurons get affected in different parts of the brain and causes different signs and symptoms. For example, the hippocampus is responsible for memory. And same thing, different parts of the brain, if they get, and we'll come to the cause of the dementia in a minute, as they get affected, you see different functions. So difficulty completing familiar tasks like brushing teeth or combing hair, or recipes they know by heart before, now they're having difficulty getting that done, is very common. Confusion with time or place, they get lost. They used to go to the grocery store without any problem. Now the cops is calling on your mom saying, hey, we found her here in the parking lot next to the Publix. That's pretty classic. Trouble understanding visual images, spatial relationship is another common one which can happen early on. Interestingly, just remember that the changes in the brain can happen decades before you start seeing signs and symptoms. So it's a very tricky disease. By the time you're seeing signs and symptoms, unfortunately, there's a lot of damage already done to the brain. So earlier we can pick up these signs and symptoms, you know, better chances of making a difference in terms of treatments and lifestyle changes, and we'll come to that in a minute. So new problems with words and speaking or writing, you know, they confabulate. They will say, for example, you know, they will forget what's the wristwatches. They will say hand clock, for example. They'll come up with their own words. Now, misplacing things. Okay, misplacing things and losing ability to retrace steps. We talked about that. You know, they will lose their wallet, they will lose their keys, and they couldn't find where they are or where they were before. Decrease or poor judgment. That's very difficult for the loved ones, because you know they will make bad decisions with trusting someone, and you know, paying wrong bills or double bills. You know, those are serious financial ramification. Now, as it get more advanced, or you know, they start getting withdrawal from the workplace and social activities, and then that's a, you know, very sad situation, because they could be at top of their powers 10 years ago. Now they don't want to go to the clubhouse or participate in day-to-day outdoor activities with the loved ones. And change in the mood and personality is another important one to remember. I got a great video I want to share with you. Let's go to that. This talks about what happens with the brain. Why are we getting these symptoms? So this is from NIH, and it's a very fantastic video. Before we go there, let me see who put comments, who got into our raffle today for $25 Publix gift card. All right, so let's put them up there. So Mary Jane Cronin is saying, I'm watching. Thank you for the information. Thank you, Mary Jane, for watching. Our favorite, let me get rid of the screen here. Here we go. So we can see the comments better. All right, so now we got Mr. Naresh Gupta saying, Naresh and Nirmal is watching. So you are in the raffle, Gupta ji, for $25 gift card, which we're going to announce on our next podcast, which is Dementia Part 2, on next Thursday at 4:30. And Naresh is saying he enjoys the presentation. I appreciate your kind words. Colleen is saying, hi, Dr. Mahajan. Hi, Colleen. Thank you. And we got Renee. Renee got she's always supports our podcast, so we appreciate that. And we got Stephanie, and she's saying, dang, I have dementia. No, Stephanie, you're too young. Maybe just stress of work, and we'll come to that. You know, that's an interesting point Stephanie brings. A lot of time, you know, losing words, or not able to come up with words, or, you know, your thinking is slower. You don't have dementia, you know, as long as you remember later. And there are certain conditions which are reversible, which can cause memory loss. And when I do the section on diagnosis, I'll address those. So let's watch this video, and we'll come back. If I see we got a lot of people watching us right now, and they're not putting comments. They don't want $25 gift card from Publix. You know, they're probably independently rich. So they don't want to participate in the a raffle. We got another comment before we go to the video. Sharon said, thank you for the information. Would you please educate on fears that comes with a patient? That's a great question. Sharon, hold on to that thought. We're going to address that in our part 2 section when I do with David, the caregiver. You know, that's going to be a very good segue to talk to him, and I'll address that. And then we got Rosary. She's a strong supporter, and she watches our webcast, and I'm glad you put a comment there. hopefully win the $25 gift card, Rosary. Appreciate your support. All right, let's go to the video piece now. And that's a great video by National Institute of Health. It talks about the causes, and that will help everyone understand what are the treatments and what's in the pipeline, because you will see that it's not a curable disease yet. So what are the causes? If we understand that, well, then we can be able to understand where the cure going to come from, if ever it's going to come from. So here we go. Let me make it a bigger full screen, and let's play it. So here we go. So as you can see, it's talking about how the brain works. The neuron constantly communicate with each other through electrical charges, which release chemicals in the neurons, and that's the junction, the gaps, and they talk to each other. And then there are astrocytes and microglia, which keeps the neurons healthy by phagocytizing and taking the debris away. Now, what happens when there is toxic changes in the patients who have dementia? Now, before the first sign of dementia, researchers believe that the two proteins, the beta amyloid and tau, which can get in the brain and start accumulating and form tangles. As you can see, all these tangles are getting formed from the beta amyloid clumps and neurons getting affected. And at the level of, once the amyloid reach a tipping point, there is a rapid spread of tau protein throughout the brain. And, it start causing Alzheimer's symptom. So if you see the brain, there could be, reduced blood supply to the brain or lack of oxygen as well. So, there it is multifactorial, and the inflammation can also cause too much damage to the brain cells, and the brain's regular process of scavenging and cleaning by astrocyte and microglia won't work. And then what that leads to is what we alluded to, different parts of the brain like hippocampus, which is the memory part of the brain, start getting affected. Your decision making, language problems start happening because there's too much tangles and the brain is not talking to each other. The fibers, the neurons are not speaking. And then as it progresses, then you will start saying the functional activity of the brain get less and less. And, at a molecular level, that's where right now the scientists are focused to see how we can develop effective therapy by addressing various factors. And then, the advanced imaging the brain, for example, the PET scan can look at the functional aspects. There are body fluids and biomarkers now available, which can pick up the tau protein in the blood, and it's coming up, I think, within a year or two, the FDA going to approve that test for early detection. And then we right now are doing in the CSF. So that's leading to the new therapies once we understanding how the amyloid and the tau protein are affecting the brain, how the vascular system is getting compromised, how there is less sugar, how there is so much inflammation, and what kind of intervention we can do, and we'll cover that. So that's a great NIH slide, and I'm going to get out of there now. All right, here we go. So, I hope you enjoyed that short video, and I enjoyed it, to be honest, and it gave me great, insight, and I'll tell you why I say that, because, unless you don't know why you have a disease, you cannot have effective therapy. And unfortunately, though a lot of money is being spent because it's a big epidemic in the senior population in the United States and Western countries, but we only have 5 or maybe 6 FDA-approved medications, and none of them can cure it, unfortunately. So let's talk a little bit about how to diagnose. We talked about the causes, and that can help us understand how to diagnose. So the first step in diagnosis is, in my practice, I teach a lot of nurse practitioner students, and I tell them, do one thing right and you'll get a good diagnosis. That is history and physical. So what I mean by that, if you take a detailed history on a patient who's having memory loss, you can make pretty much a good diagnosis without even, unless it's very early and very subtle, you can make a good diagnosis what could be the probable cause of memory loss. Let me give you an example. I saw a patient last month, 78-year-old gentleman, came with his wife, and new patient to our practice, has been getting more memory loss and no family history. And that brings me to another point. I'll talk about family history in a minute. Let me finish this case. So, he was getting more withdrawn, and he was not participating in bingo, which he used to love, not going out playing golf. So I took a history and we did a depression screen. Long and behold, he was way too depressed, but it was manifesting as memory loss. And we placed him on a SSRI called Lexapro. And within a month, there's a day-night difference in his attitude. He was better groomed when I saw him next time. His memory was much better, and he was more participating in social activities. So that's a reversible cause of memory loss right there, depression. And and if you do their imaging, and we'll come to that in a minute, you won't see anything, because it's more to do with chemical imbalance from depression causing the memory loss. And these are the cases we call pseudo dementia. That means they don't have real dementia. They have what looks like dementia or pseudo dementia. We're still looking for comments, guys. I know there are a lot of folks out there and watching our show. Please do put a comment what part you enjoyed in my videos so far. If you want anything different, anything you want addressed, please put a comment. And we'll get you in the raffle for the Publix $25 gift card, and we're going to announce the raffle winner on our next part 2 of the dementia. We're going to do on next Thursday at 4:30. All right, so again, history and physical, good history. And family history, only unfortunately or fortunately 1% of the Alzheimer is familial, which means, that means it runs in the family. And it's very useful if someone has that for research purposes. There is a dominant gene they have, and they can be sent to a genetic counselor, and then we can do a testing, and we can make that diagnosis early if they have, in their 30s or 40s, the siblings or mom and dad had dementia. In Latin America, there are a few places which are clusters of that, and they're very useful for drug development and vaccine development. Interesting, there's a vaccine, we'll talk about that, which is maybe useful coming down the line against the tau protein, which we just showed on the video. All right, so we talked about history and physical. And the physical exam, you may or may not see a whole lot, but you may see some other. So there is something called mixed dementia, or dementia with features of Alzheimer's, features of Huntington's disease. Not so much Huntington is very characteristic, but Lewy body dementia, vascular dementia, or frontotemporal dementia, there could be overlap in what we call mixed dementia. So, on physical, if you're seeing a tremor or rigidity or shuffling gait, then you're looking at Parkinson's disease, and that can progress to dementia. But at least you can make a good diagnosis of Parkinson's disease, and that's a separate entity. And sometimes it does not lead to dementia. So it's good to make that distinction, and hopefully get some right kind of medication with that diagnosis and help them with the tremors at least. Again, that's a progressive neurodegenerative disorder, Parkinson's disease. There's no cure for that, but there's a lot of other treatment modalities to slow it down. So, and the family history is important for Huntington disease. And, also within the social history, smoking and alcohol is critical because both reduces blood supply. As I showed you in the video, the blood supply to the brain is critical to keep your brain healthy and functioning well. So, by cutting smoking and alcohol, believe it or not, causes serious memory loss and dementia. And by reducing or stopping the use of alcohol, you can reverse it. So that's another good point in history, that they may be thinking Alzheimer's, but it could be, substance abuse or alcohol. A lot of medications, for that matter, can cause memory loss in older adults. For example, chronic narcotic, chronic benzodiazepine like sleeping aids and anxiety medications. Sometime in older adults, drugs which are given at a higher dose than you normally do because the metab is not as good with liver and kidneys, not able to get the medication out. So, all those medications which are working through your nervous system can have serious side effects like seizure medications, even medications like bladder medication, Detrol, oxybutynin. They can have effect on your memory. There is some data on proton pump inhibitor affecting your memory, though it's sketchy. But what a point I'm trying to make is, if you're having memory issues, less medication is a better strategy. So having a detailed history on medications, in my opinion, is very critical in looking at reversible causes of memory loss. And we may say, oh, Alzheimer's, but they may be having just the side effects from medication, and you reduce the number of medications or stop the unnecessary ones, you will see improvement in the quality of life. You may not be back to baseline, maybe it's a combination of issues, but at least, there's nothing lost by stopping someone's, hopefully, if they can tolerate, like their bladder medication, or cutting the gabapentin, or, any of those seizure medication, if they're not having active seizure for the last 2-3 years, and the EEG is okay, then maybe cutting the seizure medication. Again, you have to do under supervision of a neurologist or a primary care physician if they feel comfortable, but it's worth a try. All right, so we talked about physical exam, we talked about history. In my opinion, that's 80% where you're going to make a diagnosis if you take a good history and physical. Now, now come to the fancy part of the testing, which is the imaging of the brain. And you can do CT scans, MRIs, and there's a newer test, the PET scan, which can pick up, the Alzheimer's early. You have to get special, clearance because the expensive test from insurance companies. A lot of insurance companies don't cover it. And then you can do blood testing to check for a lot of things which can be missed, can be picked up on the blood test. For example, vitamin deficiencies. If you have B12 folate deficiencies, and you can reverse that, or thiamine deficiencies, that will improve your memory. So those are simple to reverse if you were thinking about it. Now, again, let me reintroduce myself. This is Dr. Mahajan. I'm a board-certified internal medicine physician. I'm practicing for the last 25 years in Pinellas County. And we are happy to take your referrals. So I'm going to pitch in for myself here. So if you have friends and family, do refer to us. It's helps a small business like mine to get word of mouth, and that's how we get most of our patients. And do share and like and love. If you like what I do on my webcast, do put a comment. We're going to put you in the raffle for $25 Publix gift card, and share it with your other friends and do a watch party. That will spread the word. I put a lot of work in my presentation, and I think it's of use. A lot of people have told me that it's of use. Even if you're watching later after you come back from work, do put a comment, do give us a like. That gives me a lot of hope and support that my message is getting across. So it's very critical for me to see your participation. It should not be one-way thing. If you have questions regarding the material I'm presenting, please bring it up. I may not answer it right away, but I'll reply back once I finish the live broadcast. Sometimes I bring a question if it's burning and important. All right, so let's go through the next section of what can we do. Now we establish a diagnosis. And by the way, I was talking about a test for different proteins, the tau, the amyloid, and even smaller proteins and other proteins, which the scientists are picking up, the inflammatory markers. And they're combining all that, and there is a test coming up, hopefully in a year or less, which is going to get FDA approval to pick up the damages done on the brain before even we can find it in the signs and symptoms. So the question will be, what can we do about that? Because now the research is ahead in terms of diagnosis and the treatment is not there. But that's how you advance the science, by picking it up early. Maybe you can find a treatment then. So I think that's very exciting in terms of picking up on a diagnosis with a blood test. So I'm looking forward to getting that test in our arsenal to pick it up early, the devastating disease, if we can slow it down. So let's talk about how to reduce your risk for dementia. Let's say you made that diagnosis that you have dementia, whether it's vascular, if you have strokes, small strokes or mini strokes, and sometimes they're silent. So don't think, if you don't have your facial droop or left or right side weakness or slurring of speech, if you don't have any of that, you don't have the strokes, it could be silent. So it's very important to keep that in mind, that if you are having symptoms and we ruled out the reversible causes of dementia, then you should get the imaging of the brain to confirm whether you have vascular dementia. So let's say you have now diagnosed with dementia, a loved one has diagnosed with dementia. What can we do? Something simple, like physically active, and can reduce your risk of dementia moving forward. As I showed you in the slide, there is inflammation, which can make the situation worse in the brain. There is reduced blood supply, and by doing exercise, you can address that. Believe it or not, eating healthy is critical in reducing your risk of dementia, or if you have dementia, slowing it down. And you will ask me how, and I'll give you the same example I gave you earlier. There is a connection between head and the heart, and that's been proven scientifically. It's not just I'm making it up. So what I mean by that, so what's good for your heart in terms of cardiovascular aerobic exercise, or Mediterranean diet, plant-based diet, whole grain, fatty fish, oily fish, is good for your brain. So why? Again, it boils down to inflammation. Inflammation is a common culprit for a lot of medical diseases, including coronary artery disease, including Alzheimer's, dementia. So a lot of time we don't make that connection between head and heart. There's a strong connection. So Mediterranean diet has been proven to reduce both the risk of future heart attacks and slow down the dementia or aging of the brain. So there are areas in the world called blue zones. I don't know whether you heard about that, but the people who study human lifestyle, and they love that blue zone. So there is a blue zone in United States called Loma Linda, and then there is a close to United States, Costa Rica, and then there is one in Japan, Okinawa, and there is one in Italy. So what are the common pieces in those blue zones and the dementia which I'm talking about? The common pieces are these people live longer and healthier and have less heart attacks and cardiovascular as well as cerebrovascular events like dementia. And the common thread is they are active, socially together, tight communities, and a lot of plant-based diet, a lot of diet which includes their locally grown foods. And that's critical, to understand the connection in inflammation and dementia and heart. So if you do that regularly, those things, you will have less dementia. Even if you program to have it, you will slow it down. Let's say, smoking we talked about, that's a no-brainer. It reduces the flow to the brain. Again, it comes to common theme. If it's bad for your heart, it's bad for your brain. So don't smoke, guys, or at least cut down. If you can take one thing from my podcast, and I know a lot of physicians listen to my podcast, a lot of PAs and nurses and healthcare workers listen to my webcast, and a lot of stress in our lives, and we use different substances to relax us, like smoking and alcohol. And in fact, we are killing ourselves with, reducing a quality of life. When we retire, it will help. It will hurt our brain health, our cardiovascular health. So if you can cut back on smoking, cut back on the alcohol, your brain will thank you for that, and you can be more functional and more. If you think about it, if you have all the money, because you worked hard during your gainful employment years, and you have the money now in the bank, but if your brain start shrinking and you start having memory loss, you'll be in a memory unit, and your loved one will enjoy your fruits of hard work, not you. So if you reduce your consumption of alcohol and smoking, then you will improve your quality of life as you get older. And exercise your mind. So what I mean by that is brain aerobics. Same thing, cardiac aerobic, brain aerobic. So keeping socially engaged, learning a new language, they're critical. Keeping occupied, volunteer activities, going out, playing bingo, playing golf, could be anything, could be whatever makes you have fun. Dancing is fantastic. Music therapy has been used in a lot of memory centers I go to, and they have been successfully using music therapy. And if you can create music, fantastic. If you're not able that creative, play music. Any kind of music is good for generating new neurons in your brain and slowing down the dementia, reducing the risk of dementia. So there are a lot of things you can do short of medications. I didn't even touch on medications yet. So that can take control of your brain health. And not only your brain health, your overall health. Anything I talked about here is all proven scientifically. It's not just because Dr. Mahajan is saying that. It's good for your brain, good for your heart, good for your body. So nothing to hurt you there, just that getting in a habit of doing it consistently. Okay, let's talk about treatment modalities quickly. Unfortunately, the drugs we have, they've been around for a long time now, more than 10 years. They became generic, which is the good part, but they mostly help you with the mild early dementia, maybe moderate dementia. There are 7 stages you can look up. That's more for academic and research purposes. But what are the drugs? So there are cholinesterase inhibitor, the common one, the Aricept, the Exelon, the Residine. All of those drugs have some benefit early on, but as the brain get more entangled in the tau, the amyloid, and the inflammation, they become useless. So it's there's some value, but unfortunately not a cure. Same thing with the Namenda or Memantine. It's useful in early and moderate dementia, not in later cases. So what are the newer treatments? So I know you guys are looking for a slam dunk, and there's no slam dunk. I think a lot of researchers are talking about multi-point treatments like HIV therapy. For example, in HIV, we block the virus at different points of it attacking the body and replication and all that. Same thing in Alzheimer's disease and dementia. We are looking at blocking different parts, as I showed you in the video, with the inflammation, the tau protein, the amyloid protein, the vascular insufficiency, the glucose metab. All those are the different points where we are shooting now. Let's get some comments in. More comments you're going to put, more you're going to have a chance of getting in the raffle for $25 gift card. Again, let me reintroduce myself. My name is Dr. Mahajan. I'm a board certified internist here in Largo, Florida, beautiful Pinellas County, lovely beaches. Still have a lot of coronavirus despite all the heat wave here. So hopefully you good folks are wearing your mask and keeping your social distancing and washing your hands. And I see the number of cases are getting a little bit less. We have, I think today it's 7,000 few cases, 7,000 in that ballpark in Florida. So it's better than 10,000 we've been having a couple of weeks back. So I think it's making a difference as long as we all do our part. So let's get to the comments again. Let's see who we didn't see or cover yet. So we talked about, let's see, we got Tracy Boy saying, hi, great info, doc. Thank you, Tracy. David is always supporting our webcast with Sharon. Sharon saying, we're both watching. Thank you, David. Let's see. He's saying, no to number 4 beer. Good for you. Well, you don't like your brain or your heart or your liver to work well, David, go for number 8. Sharon will find another good-looking dude. Let's see. Bina Steven. Bina is a fantastic frontline worker for many years, and I appreciate, Bina, you tuning in. We got Bragi, and she's a great athlete herself, and she says, I rock, and thank you, Bragi, for watching our podcast. And we got Ray Davis. Ray has made me a UAW honorary member. I go to Ray's UAW local Pinellas County chapter for many years. We've been going there a couple of times a year. We give talks, and now, since we can't go to the Greek church where Ray does phenomenal work with the local UAW chapter, I moved to the social media piece, and Ray is still following. Thank you, Ray, for making me a UAW member. Hopefully I'll get the pension as well. All right. Heidi is watching us. She said she was in her office a little while ago. Turn on your stream when I go home. Thank you, Heidi. That was very kind of you. Thank you for everyone for watching. I know it gives me a lot of strength and encouragement to see your comments, and it gives me because a lot of goes into it. It's not just me doing it. We have behind the scenes our good-looking office manager, Debbie. If you see her next time, you do tell her that she does a great job in helping me put this together. And then we have our nurse practitioner, Jackie. Her son, Kobe, has been helping us too. So Kobe is doing a good job getting all the audio visual and the lighting, all that set up, because it's a tremendous work, and a lot of things go wrong if you don't pay attention. So it is a lot of effort on our side. So we do appreciate the community support we are getting from all you good folks. And keep watching. And if you have any topic in mind or any guest you want to see, we'll try to get that in a future webcast. All right, new treatment. So let's get there. Let's see, new treatment. All the video you saw, that's will get you pointers in terms of new treatment. The first one is recruiting the immune system. So the immune system is a very powerful organ. As you can see in COVID-19 era as well, we are recruiting immune system left and right, whether it's vaccine or whether it's Actemra, the IL-6 inhibitor. We are using the immune system, or shutting down immune system, or using the immune system one way or another in terms of COVID-19 or any infectious diseases. Same thing with inflammation. The immune system, if it goes overboard, you got to back it off. And there's a new FDA drug coming out for, Alzheimer's, I think sometime this year, which is going to reduce the inflammatory response in the brain. So that's going to be exciting, and we'll see how it pans out. But as I said, you got to attack different targets in the brain to make dementia, become less of a burden, which is right now, multi-billion dollars people spend on the work they would be doing and the work loss they have because they've been helping their loved ones. So hopefully, by getting effective treatment at multiple steps, we can reduce the effect on the society. So preventing destruction, again, the same concept. Before the amyloid sets in or tau protein sets in, there are different smaller steps we can attack and block, like antibodies, and we can reduce their destruction. And same thing with production of blockers. It's the same concept on different steps of the brain. There is a vaccine we talked about earlier on against the tau protein, which is very exciting. That if you and the work is going on that, so that should come out soon. Hopefully, it's effective, because all those things look good on phase 2, phase 3 trial, as we're seeing with COVID-19, and 90% of the vaccine, unfortunately, are not effective or have too many side effects. So unless it's there, it's not there. But at least the concept is very encouraging. So that pretty much covers dementia as a whole, but we didn't touch specifically the caregiving aspect or living arrangement aspect, which we're going to cover at length in our next Thursday at 4:30 podcast. But it's a difficult condition. I see every day in my practice the impact it has on the loved ones in terms of cost. It's tremendous cost. Look at the memory unit, how much they cost. 5,000-6,000 is the base price, plus anything additional per month. So that's huge for people who have not had any whole lot of savings. And even if you're taking care of them at home, the mental cost of the caregiver. So we're going to go in depth on that aspect in our next podcast on next Thursday at 4:30. Now, if you're watching, I want you to put a comment in the comment section, as we're doing a raffle on everyone who's commenting today. And we're going to give out $25 gift card or for a public gift card on our next part 2 of the dementia with David on the caregiving aspects of dementia. So the last piece we always do, and I think a lot of people appreciate that, is the breathing. So the breathing is, in my opinion, one of the key pieces which got me into the webcast, is to get the word out about how the breathing can help you cope with your day-to-day stresses, especially in COVID era. And even with non-COVID era, we have a lot of stresses with relationship, with kids, with finances, and work, life in general. So, and the breathing is a fantastic tool to help you control your sympathetic and your parasympathetic system. For last few podcasts, webcasts, I've been talking about 3-part breathing. And I feel I need to keep doing that, and today as well. I'll tell you why. I think I was very impressed when I did research on 3-part breathing, that the volume of the lung goes up 7 times if you do the 3-part breathing on regular basis. That's crazy good. 7 times, even if you get to 5 times your lung volume, and if you, let's say, have scarred lungs from COVID-19 or COPD or pneumonia in the past, and you can increase the rest of the lung to expand, it's really tremendous the amount of power you're going to get in terms of your energy level, your fatigue. Oh, by the way, one thing I forgot, and I think I should have mentioned, and I was intrigued by that in dementia, is the hidden aspect about sleep apnea. So while I was talking about breathing, I remember that. The sleep apnea, if you're obese, have thick neck or big uvula, and you snore, and you're having memory loss, get yourself a sleep study. You will see, if once you get used to with the mask, the BiPAP or CPAP, after 3 to 6 months, you will see your memory will improve, your mood will improve, because sleep is very important. Sleep is intricately tied with all the bodily function, not just the dementia or memory loss. So it tied with cardiac arrhythmias, it tied with pulmonary hypertension. So If you can sleep better with REM sleep, not with chemical sleep. In fact, the sleeping aids can affect your memory. The temazepam, the ambience of the world can have a hangover next day. So just the REM sleep, if you get better with meditation, with breathing exercise, will have impact on your brain too. So let's do the 3-part breathing. It's very simple. It's not that hard. We got few comments. Let's get the comments out, and then we'll do the 3-part breathing. So we got, let's see, Vincent is saying $25 Publix gift card. He's in, man. Rupa, thank you, Rupa. She's been watching our webcast for the last 3-4 times, and she has very constructive comments. She is a fantastic physical therapy, do fantastic work at Largo Medical Center. Thank you, Rupa, for giving great comments and listening to our podcast or webcast. We got Sharon. She's saying she's watching with David. She wants to get her own Publix gift card. She doesn't want to share with David, though David did mention Sharon's name. But we'll put them separately. What the heck? We like you both. All right. So that comes to our last part of our podcast, my favorite part, which is to teach you and teach myself different aspects of breathing exercise. Today is 3-part breathing, or it's also called Diga Pranayam in yoga circles. So what's 3-part? Let's explain that. 3 parts is your belly, your abdominal muscles, basically, your diaphragm, or just the lower chest wall, and the upper chest or intercostal muscles just below your rib cage. So that's a 3-part. So how do we do it? You can sit up like I'm sitting with your spine straight, neck up, and chest up, or better, you can lay down, and fold your legs. That's another better way to do that, because you can observe. If you don't have your shirt on, you can observe your belly going up and down, your chest going up and down. That'll give you visual. Once you get that down pat, you should do it with closed eyes. All right, so what's the first step? The first step is to blow up your belly like a balloon when you inhale. So do that with me. Inhale. The belly should go forward, right? And then exhale, and the belly button should go towards your spine. So like, let's do one more time. Breathe in and let the belly go forward. And then breathe out. It's very simple. So breathing, when you inhale, the belly should move forward. When you breathe out, the belly button should go back. So that's the first part, using the abdominal muscles. And guys, we don't use it. If you observe your breathing when you're anxious, when you're nervous, the most part of the chest or the body we use for breathing is the shallow breathing, which is the intercostal muscles, the upper chest. And that does not get deep air deep down in your lower lungs. So very important to involve all 3 parts of your the body to get deeper breath in. So we just did the abdominal part. Now let's add the diaphragmatic part or the lower chest part. So let's do the same thing which we just did. Breathe in, get your belly up, out, and then add 1 part more to your lower part of your chest. So now your lower part of the chest is full, and now I want you to breathe out from your chest down. So again, what we did is we made our belly blow up when we inhale, and then we added some more air to the lower chest, involving our diaphragm now. Now the third part is just below the collarbone. So this time when you breathe in, you blow your belly, and then we'll get some more air just above the diaphragm, and then we'll get some more air just underneath our collarbone. So let's do that. Breathe in and blow up your belly, and add some more air to the lower part of your chest. And now add a little bit more air to your just below clavicles. See the heart lifting up? That's great. Now keep the chest and your intercostal and your upper spine straight. Don't slouch. And then breathe out from here first. And then push the belly button back. So that's it. Now breathe normally. I know you did a little bit of exertion. I don't want you to get dizzy. If you're getting dizzy, always stop and take some deep breaths or gentle breaths, just your normal breaths. Now we're going to do smoothly. All 3 parts we're going to do smoothly. So let's blow up the belly, lower part of your chest, and just below our clavicles. So all three parts we're going to do in one smooth motion. So let's try that. And then breathe out from your chest down. Let's do one more time smoothly. And then breathe out with your chest down. Beautiful. And last time, breathe in, push your belly button up. And then from chest down, breathe out. So do it 10 times, 3 times a day. And if you get good with doing this, you can do a variation. What's the variation? With every breathing exercise, the variation is you make the exhalation longer. Why? So let's address that. Inhalation affects your sympathetic system. Exhalation affects your parasympathetic system. So what's the difference between sympathetic and parasympathetic? By the way, guys, the sympathetic and parasympathetic is your autonomic nervous system. If you read up about it, breathing is the easiest access voluntarily we can control our autonomic nervous system. There's not many tools we have, to control our autonomic nervous system, which is as easy as breathing. What I taught you over the last 4 months, different skill sets. And the parasympathetic system slows you down, it relaxes you. So if you can make your exhalation longer, then your inhalation in any pranayama or breathing exercise, it will get you a calmer brain. So very important to think about that. If you think about, any breathing I taught you, 4-6-7 breathing or alternate nostril breathing, if you can make your exhalation, and the 4-6-7 is self-explanatory, you're making the exhalation longer, it will give you better calming effect on your brain, and you will be less anxious. With that, we come to the end of our podcast. I appreciate everyone putting the comments. I know, I pushed you with a little bit of enticement, but whatever it takes, it's tell me that you guys are watching us. I'm not just talking in thin air, and we get a lot of views, but it's good to see who's behind those views. So even if you're sharing with your friends and family, do tell them to comment, and anything which you didn't like, anything you liked, anything you want in future webcasts, breathing exercises, how are you doing? Are you having any difficulty? I want to know all that. That will give me more input on which direction we should take this social media webcast for future. Thank you so much. And be kind to yourself. Look in the mirror and smile. Count all the blessings you have. We all have a lot of blessings. We got tummy full, or we got roof on our head, and half the world population don't have that. So look at it's all relative. And be nice to your family, friends, neighbors, fellow human beings. And more importantly, be nice to biosphere and planet Earth. And I will see you for second part of the webcast on our program on 4:30, and we're going to have joined by David. He's a fantastic German philosopher, and he's a German history professor. Unfortunately, his wife is having dementia, so he has a bucket load of knowledge of how to cope, and he is willing to share. Thank you for watching. Thank you for putting comments. Ciao.